When I wake up in the morning, I think of a cartoon I once saw of Lyndon Johnson. It showed him sitting on the edge of his bed, getting up and saying, "World, I'm coming, ready for me or not."
Ken is the consummate Southern doctor. I can't imagine a single individual at this hospital that is as compassionate around patient care as he is.
Everybody wants a physician who's intelligent, who's dedicated, who has a great bedside manner, who has their interests first, and Ken exemplifies all those qualities.
Ken uses his head, he uses his heart, and he does the right thing.
Dr. Walker has trained hundreds of internal medicine residents during his more than 40 years at Emory. He trains them directly at the bedside of the patient, in classroom training, and through his personal example.
He taught a class called Clinical Methods, which was a behemoth, a huge class, and he wrote the textbook for that course. No other textbook like it. That's the first time where you put the stethoscope in your ears and you put it on a patient's chest. And that may be the only thing that you do that day. And Ken taught thousands of students how to do those things.
Morning report. Morning report is when every patient admitted to the internal medicine service at Grady in the preceding 24 hours would be presented to Dr. Walker. At this time, you would be interrogated by Dr. Walker.
He asked an upper level resident why this patient had not had a rectal exam. And the resident said, "Well, I thought the intern was going to do that. I left that to the intern." He walked over to the resident and he said, "You should have done that."
It had to be apparent that you had the best interest of the patient at heart, that you had a thorough understanding of the disease process in question, and that you exerted maximal effort for the benefit of your patient.
And the resident said, "Well, I thought the intern was going to do it. I trusted them to do it." And Ken said, and this is one of the pearls from Ken, he said, "I don't trust anybody like I trust myself." He was saying, you've got a job to do. You don't relegate that to somebody else. You make sure it gets done. If it's not done, you do it.
The dean of the medical school in 1992 called me one day and said, "How about going to Tbilisi for me next week?" And I said, "Sure, Jeffrey, where is Tbilisi?"
Post-Soviet Union period in Georgia was very hard. Education system, healthcare system, it was totally destroyed. We would study medicine in hospitals which didn't have electricity.
We visited all these hospitals, and I saw that Georgia was a small country and that the healthcare system was something that one could deal with as a unit.
Ken has really been instrumental in engaging people at Emory and people at Grady, nurses, physicians, pharmacy, to really, learn about that commitment, what's happening in another country.
We had brought over about 100 of their medical school graduates and put them through Emory house staff programs.
There's no question when Ken is around who has the idea and who's going to tell you about their ideas.
We had put about 4,200 practicing nurses through an intense 1 to 2 month clinical upgrade course.
And there's no negotiation. If he thinks something needs to be done, it's going to be done.
We set up the Kobaladze Emory Learning Center.
I think he's the most generous man I have ever heard of.
We established the specialty of emergency medicine.
Dr. Walker is action-oriented and never gives up.
We did a renovated medical school curriculum modeled after the Emory curriculum.
All these Emory people actually got to Georgia because of Dr. Walker's initiatives. I think that's one of the greatest characteristics he has, that he can get others interested in doing good.
Ken is the consummate Southern physician. He's taken his concern, his compassion from Atlanta to the state of Georgia to the Republic of Georgia.
His impact goes out through those who know him and who have worked with him on all of these various projects.
Boundless energy, surprisingly ingenious, resources that astound me.
Ken, congratulations on the Lifetime Achievement Award. There is nobody that I can think of who deserves this more than you do.
It's been a great pleasure of mine to be along and participate in many of those projects and see firsthand the impact that they had.
No one has taught me as much as you.
Ken, this is an auspicious award at an auspicious time in your life. Congratulations to you.
You have done so much for everyone around you. We all wish you to be for a very long time with us.